Hi, my name is Dr. Janice Jurak from Muskego Health and Wellness Center. Today I wanted to talk about a foam roller. This is one of those nice inventions that looks easy, but for some reason some people have trouble on figuring out how to use it. So I definitely wanted to make a video today to show you that the proper way to use a foam roller and give you some ideas. The first one I want to talk about is with the spine. We all have a spine that should have a normal curvature to it in the neck, the middle, and the lower back. Generally, if someone's middle back is hunched forward, such as this, that is not a normal curvature. And what is actually happening is the nerves, which are these yellow cords you see, can get pinched, and that can cause a lot of back pain. Not to mention your posture looks horrible. It's hard to breathe. It can lead to a lot of other health problems. Not normal. So I highly recommend chiropractic care, some good chiropractic care to get these bones of the spine freed up, get them moving better, get them lined up, and get your posture back on track. What can happen though, because of the misalignments in the spine, is the ligaments, the muscles get extremely tight in the area. It can be very difficult to relieve that. The more you can do at home as far as stretching and therapy in that area to loosen all of those structures up, the better the chiropractic adjustments and the faster that your posture will get itself back to normal. So I want to show you something you can do with the foam roller that will assist you in getting that posture back, get that curvature back in your middle back, or we call it the thoracic spine. You want to lie the foam roller, and where do you buy these? Any sporting goods store. I know we always carry a couple at our office as well for convenience sake. They come in different sizes. I'd recommend a long one if you're using it for your spine for that purpose. And this one's pretty firm, so the firmness, it's pretty firm. You want to put it on the floor, and you actually just lie on it along your spine, and it feels quite good and comfortable. In fact, I have a pretty normal curve myself, but I enjoy it too. So you just lie on it. And you want to do this maybe if your curve is really bad for like 5 minutes a day and increase it every week, or you can start just like 15 minutes and increase it from there. And oftentimes I'll have patients pull their shoulder blades back and then bring their arms up and kind of squeeze the hands together and then bring the arms down and just really squeeze that and feel how it's changing the curvature. I will warn you that once you start first doing this, it's changing the ligaments, so you might be a little bit sore at first, but don't let that discourage you. Keep it up. After lying on it that way, you can actually turn it the other way and lie on it like that. And you can roll your back like a little self-massage. Now, if you can find the part of the curve that has the most curve to it, you can hold it. Now I recommend having a pillow or something here, or I oftentimes will just support my head, let my head rest on my hands. And you'll feel that spine opening up. Again, it might be a little uncomfortable. That's 2 uses for the spine. Unfortunately, with us sitting a lot, standing a lot, on hard surfaces for instance, a lot of us get tight hips. Especially women, tight IT bands, tight glutes, tight hamstrings, tight quads. Well, this works as a self-massage tool as well. If you're using it for this purpose, this length works just great. Or if you get one that's maybe about half this length, that's fine too. How you do this is to do the IT bands and the hips and the glutes is you put the roller like that. Now I'm sitting directly on top of it. If I'm going to roll out my right side down here, the right side is down. My left leg comes over like this. And then you roll. Roll down. I'm using this leg to assist me up and down, and my arms a little bit too. Now the further you roll it, see how I'm getting into my IT bands here, closer to my knee. If you roll forward more, you're going to get more of your quads, the front of your thigh. If you lean back more like this, you'll feel more on your glutes. You can get kind of right on those butt muscles. If you find a spot that's tight and sore, just kind of work it a little bit. So if you're totally on your side, coming up this way, IT band, glutes more, Roll forward, you got the quads that you're massaging. And again, you can go all the way up. And you'll know when you hit the spots that you need. Okay, you'll feel it. I do recommend, even if there's one side that's more of the problem, that you do both sides. Keep yourself symmetrical. Well, I hope this has been helpful for you. But please do not hesitate to call me if you have any questions on how to do this exercise or how chiropractic care might even benefit you and your spinal health and the overall health of your body. 414-422-1203.